Alright, so now we're talking on the introduction to anatomy. So let's get right into it. Now, anatomy is a study of body structures. It focuses on the organization of body parts, and we know that we have lots of body parts. And not just the body, it also studies the relationship between structures. And it's important in medicine and also in nursing, and in fact it's like a bedrock, or I'll say a foundation of the health sciences, because I don't know any health science that anatomy is irrelevant in. So what are the importance of anatomy? It helps you understand the human body. It's a foundation, I made mention of that, for physiology and pathology. It assists in diagnosis and treatment. It's important in surgery and nursing care and supports safe healthcare. So anatomy is very, very, very important. It's the foundation. So what are the branches in anatomy? We have four. We have the gross anatomy, the microscopic anatomy, the developmental anatomy, and the surface anatomy. Right. So when you talk of the gross anatomy, you're talking about the macroscopic, macroscopic. So these are things you can see. The study of structures you can see with your naked eyes, like bones, muscles, organs. Now the next one is microscopic anatomy. These are structures seen with the help of microscope. And take note that microscopic anatomy is also known as histology, really. So there are structures that can only be seen with the microscope, be it light microscope or the electron microscope, the electronic microscope, right? So that's microscopic, take note. And we have the developmental anatomy, studies body changes throughout life. It also includes embryology, as it talks the development from fetus to zygote. That's development of the human, of the body, you know, throughout the levels of development. That's developmental anatomy. And surface anatomy, it studies external features, body features, and it's very important during physical examination. So these are the four branches of anatomy. So what are the common anatomical terminologies which you're going to hear or you're going to make use of? You have the superior. Superior means it is towards the head. That means it is closer to the head. Meanwhile, inferior means it is towards the feet, closer to the feet. Anterior is front, right? Anterior is also known as ventral. Take note of that. Anterior is also known as ventral. And then posterior is back, which is also known as what? Dorsal. Then medial is towards the midline. Just picture the middle of your body. That's what it's towards the middle. That's the medial. And lateral is away from the midline. It's far away from the midline. Then proximal is near the origin. Origin can be joints or the beginning of that structure. So for example, you have your arm, right? It has a shoulder joint. You have the shoulder joint. Now proximally you have the digits. Distally you have the digits, which is your hand. You grab it is far from the origin, the point of connection, which is the shoulders. Your palm is far away from the shoulder joint, right? So it is distal, right? Meanwhile, the humerus is proximal to the shoulder joint, so it is closer to the origin. So when you talk about proximal and distance, proximal means it is nearer to the origin, or let's say point of attachment to the body for better understanding. And then distal means it is farther from the point, from the origin. So in summary, this is just a quick recap of, or summary of, what anatomy is. Anatomy studies the body structures. Different branches study the body in different ways. Okay, now the anatomical position, some of them which we've mentioned have they standardize description, right? Anatomy terms describe body location. Anatomy is very essential in healthcare and nursing. Thank you very much.